Most of the time, making the diagnosis takes an informed and observant doctor, not a blood test or an x-ray. Mr. Z was a strapping man of 40 and came into the office with pain primarily in his fingers. Other than the scaly, silvery skin rash over both elbows, which had bothered him for years, and the painful fingers, which had bothered him for a month, Mr. Z had been pretty healthy all of his life. His brother struggled with similar skin patches involving the scalp rather than the elbows, and a school teacher had called his rash ringworm years ago. Neither one of the brothers had seen a doctor for the rash. On examination, our patient's painful joints involved several of the fingers, causing such inflammation that they looked like a swollen link sausage. The fingernails had pits like many tiny drill holes scattered through the affected fingers. He explained that not only was he hurting his fingers, but also in his toes. And lately, he had low back stiffness and a progressive, overwhelming fatigue. We know that the skin condition of psoriasis occurs in 1 to 3% of the population, and that from 5 to 30% of those with the rash will develop one of several kinds of psoriatic arthritis. We know that both conditions are triggered by genetic or environmental or immune system factors. We also know that if we turn off the immune system, and more specifically T helper cells, with complex and powerful medicines, in most cases, we can radically reduce the pain of psoriatic arthritis. But with all that scientific talk, still, the diagnosis of psoriatic arthritis in Mr. Z is made clinically. In other words, it's by the way this man's story unfolds, along with his physical exam, that makes a diagnosis. Although supportive lab tests will be ordered, there is no diagnostic lab test or x-ray for psoriatic arthritis. This is the way many diagnoses are made in the field of rheumatology, simply by the story of the patient's illness and by the so-called bedside physical examination. To say it again, making the diagnosis takes an informed and observant doctor, not a blood test or an x-ray.